Welcome everyone. My name is Amal Nirgudkar. I'm the CEO of Patient Prism, and I'm here with an interesting guest today who I've known over the last year. His name is Matt Zubeler. He's with Smile Brands, and he's their Chief Growth Officer. And as you guys know, my love for Smile Brands has been there for a long time. I've been a big Steve Built fan for many, many years for what he has done within Smile Brands and the culture that he has instilled, and not only within Smile Brands but throughout the whole industry. I look at you guys in terms of leadership in everything that you guys do in this space, and I'm delighted to have you, Matt. Welcome to the program.
Thank you, Amal. I really appreciate it. The interest in the work that you have done and are doing to help our industry is equally as impressive. So thanks for all that you've done.
No, I wanted to obviously bring you on for a long time and really to talk about, because you guys have led the industry in terms of innovation. You obviously you have a large footprint, over 400 offices. And I wanted to really ask you a few questions, because I think sometimes when you look at leaders in the industry, even when you're an independent dentist, you can get inspiration from how you guys are dealing with this COVID-19 crisis that nobody expected, but it's upon us. So the first question I have right off the bat for you, Matt, is what has been the top priority for Smile Brands right now?
You know, it's a great question. This is something that nobody could have predicted. And it really is an unfamiliar and uncertain time. And the impact to really everyone across the board is various, right? It's emotionally impactful, it's physically impactful. It's challenging to try to maintain and develop and grow through this process. And that's what we're trying to do. The most important thing for us is making sure that our patients are safe, that our team members are safe, and that we can give great care and in service of our mission for Smiles for everyone. We've done everything we can to make sure our doors stay open, to keep patients out of the emergency room, because there are patients who are in pain, who are willing to go to drastic measures to take care of that pain. And to be honest, one of the most unsafe places they can be is an emergency room these days because of the exposure to virus and others. And so we've done a lot of things, including we've extended our hours. We're open later until at least 8 o'clock on most days. We've always been open Saturdays, but now we're open Saturdays and Sundays. So we receive patients. And we've also just launched, crisis is a great way to be able to create more innovative solutions. And we've launched a teledentistry solution as well that's available to patients to make sure that they don't have to be in the chair for us to be able to see us and assess them. So our patients are really at the core, making sure that's our priority, and then also making sure our team members are safe too.
No, so what I hear from you is obviously you're focusing on your patients, you're focusing on your team members. Safety obviously is a big concern for all of us, because that's the only way I think we're going to come out of this crisis, is making sure that everybody feels safe, our team members feel safe to go to work, and our patients feel safe to go to the doctor. And it's very interesting to hear from you, and it's a great lesson for the whole industry as a whole to take from opening extra hours and adding capacity. Because you may not be able to fill your schedule up like you used to do that before. And there's going to also be that pent-up demand when you come back. So having extended hours and opening on Saturdays and Sundays, I think it's something that's going to be part of the new normal in my view as well. So kudos for you guys to kind of have spearheaded that first. I think a lot of dentistry will have to follow that.
Well, it's interesting. To be honest, I'd like to say that this was all planful and this is all part of our grand vision about how it's all going to work. It is true that we have really focused on what we like to say is meeting the patient where they're at, right? And for years, I think dentistry has looked at the patient, and when they haven't shown up in the past year, past 2 years even, the dentist may say to the patient, "Hey, you really should come more often." And for us, it's just about being accessible and affordable. And when a patient's ready to meet us, how do we make sure we meet that person, she or he, wherever they are? And in many cases, that's either they're in pain or they want to be able to kind of avoid the dentist altogether. From our perspective, we want to be there when they're ready to engage with us. So the patient experience is so important. And you see a lot of startups that are out there today that they've got a lot of investment, are really innovating, be it from folks like Smile Direct Club or folks like Candid or folks like Henry and others, or mobile industry. They're all doing things to try to innovate around meeting the patient where they're at. And the COVID crisis, I think, only accelerates that.
No, I agree with you 100%. I think we've got lots of challenges in dentistry. One of them is getting more people in the funnel from a marketing standpoint, just to get the treatment that they need and deserve. So with respect to patients, but what about team members? What are you guys doing specifically to support your providers and all the team members? There's hundreds and thousands of providers and team members you have. Are there specific things you're doing to kind of help them through this crisis?
It's actually one of the things I take the most pride in the work that we're doing right now. Just, you mentioned this before, the culture that the team has built, Steve has built, is really about smiles for everyone. And that sounds like unicorns and rainbows. For somebody coming into the smile brands or the industry, that's actually what it sounds like. But it really is about understanding how do we make sure everybody who's involved is part of that win-win. And that means our team members, they have to feel safe. They have to feel like they're called to their mission. And frankly, if they don't feel like they're ready to practice, we're asking them to stay home, right? Because this is a choice. One of the things, when I was talking to one of our doctors, she had said, gosh, I would never wish anything like this on anyone in terms of this crisis, but it is why I signed up. And it's my calling, right? So there are people who are called to serve, to either dentists or caregivers or office staff, to be there when patients need them. And so how do we then prepare them for that mission so that they can serve? And that means one of the first decisions we made, other than staying open, was making investments in PPE. And we did all we could to make sure that we had the right masks, right gear, right face shields, and our partners have helped too. When we went to our suppliers, we asked them to make sure that they could help us with that. And at the same time, we spent a lot of money. There was a point on N95 masks where we paid 5 times the average price for those N95 masks to make sure that we would have them for our patients and for our team members, because it's that important. So we went the extra mile. Now that's in terms of the PPE, but recognize, as I mentioned before, the toll this has taken on team members is emotional and physical too.
Right.
So we have constant resources available to our team members. Now we also had to furlough folks, and in furloughing folks, we made sure that those folks got support from access to local agencies and state services. We also got them, we continue to maintain their benefits and to pay for their portion of the benefits as well, because they're not able to do that. We were able to kind of work them through a process so that they can take advantage of any PTO. So it certainly was not easy, but we were able to help them through that process. And then also communication. We are constantly, daily calls with people. We've got a daily newsletter, comes out every morning at 6 a.m. We had at one point 4 times a week video calls with everybody, including our leadership, Steve, myself, Lori Lee, Christy, our operators, et cetera, who are enabling good conversation. And even yesterday, we were on a call, there were 37 submitted questions on the video conference. We went 20 minutes later than the hour that was scheduled to make sure every one of those questions were answered. And some of those questions, trust me, were tough questions. But the fact that you've got transparency, you've got clear communication, you've got safety for patients, and you've got support were the things that really, I think we did, and the things that I'm most proud of.
Communication really resonates with us because, obviously we believe that effective communication is needed at all times, and not just during crisis. But part of I've been doing a lot of webinars with people all over the industry, and and the practices or the DSOs that are really doing a great job at it is communicating with their team members on a routine basis so that everybody feels part of a family. Because we sometimes it's disconcerting to stay home and not go out anywhere and not meet your patients or your friends and coworkers, and it has lots of implications in terms of just their psychological health as well. um, Tell us a little more about, you launched, I saw this on LinkedIn, the teledentistry platform, which I think it's about time. I think dentistry comes of age to what healthcare has been trying to do overall, and medicine has been trying to do, um, to promote telehealth or teledentistry. So talk to us about your new platform and how you're leveraging that to connect with existing patients as well as maybe potentially new patients. I'm curious to know.
Yeah, I mean, actually, if you think about my role as a chief growth officer, when we're in a time like this, right, I think the function of what I do changes. If you look at a lot of the work that we've done, it's about managing our core operations, about making sure our patients are safe and our team members are safe. But I need to have one eye on the today and another eye on the future horizon. And I looked at what the things could we do, and a lot of people either in my position and in other companies who are asking themselves, what exactly can they do in a time like this, right? And for me, it goes back to serving the patient and being able to make sure to create a great experience. And so I've spent the past 25 years in technology companies and in healthcare, and specifically either building software or trying to make startups work, or being in really large global software companies. And technology itself on its own is just simply a tool, right? And telehealth, it's not like right now there's been this huge advent of new tools and technology that's out there to be able to make this work. It really is just timing that everybody's now got a smartphone, that the tools and the ability to have a really easy, not have to download application that can enable a good video interaction is available. That internet's ubiquitous, and being in the chair is not the only way a patient can get served. And I think because of the crisis that's accelerated it, it's created that perfect recipe for something like this to really work. So about 2 weeks ago, we said, we've always said this is interesting, but it really became important. And so we just did it, what we would do, and made a very grassroots effort. So we pulled together whatever tools we had available to us. We talked to a lot of different vendors, and they had some very sophisticated tools, but we started super simple and super small. We started with 10 offices in California with one doctor to be able to have a phone number and a video conference tool. And we experimented, and we tried to see what we could learn. And we got it wrong, and then began to get it a little bit more right and a little bit more right. And now we've got it launched in all of California, Tennessee, Florida, Oregon, and we'll have Washington this week. And then as soon as Texas gets itself all sorted out, we'll have Texas too.
Now, are you guys, just a little bit more on that, are you guys letting patients know that, hey, this is available now for existing patients, you guys can schedule an appointment? Are you sending emails out, or how are you communicating that with your patients that you're open for business via teledentistry?
So we started soft, as you could expect, because we didn't know what to expect in terms of the volume. And so we just started with an email to our patients, just one email, and put it on a link on our website, not even on our main website, on our individual office site. And we got a lot of volume from that. Now we're ready to really communicate it to the market, which is, to new patients and to existing patients. We've got a couple dozen providers who are now stepping up as what we would call triage doctors. And there's really two main paths, I think, the way teledentistry can be used. One is all about triaging patients who need help and figure out where and when to get them that help. And the second path is to make it part of the treatment planning process and part of the treatment itself. In terms of the triage process, we basically have doctors who are on call. Patient clicks on a link and enters into a waiting room. They don't have to download anything. They don't have to have any usernames and passwords. They just literally click on a link, enter their name, and then can see a doctor. We can take payment over that same interaction. We can take pictures over that same interaction. It can be done on their smartphone. And so all of that is the triage process. They can show up anytime they want, and a doctor will be able to meet them. The second process, which I think is more interesting, is that not only are we able to triage, but we can then incorporate this into the fabric of dentistry. Meaning, for example, you've seen a patient, you want to communicate with them in terms of a follow-up. They have a treatment plan, and they had a few questions they want to ask. You can reach out to them and say, hey, let's have a quick conversation. Let's see where you're at. You could have it as a post-op follow-up to observe and see what's going on with that particular patient. You can make it part of their orthodontics regimen, where instead of having them to come into the office every time, you can have them check in by video. You can also prepare more efficiently when that patient is in the chair. So you know how much time to allocate and what to have ready, so that when that patient's in there, they can be there quickly, effectively, and efficiently, and maybe with a smile.
I can see these light bulbs in your head right now. How to increase your production per hour, right? I think post-COVID, right? Because we could really optimize our schedules and have this production operations management model where you're putting the right people in the right chair at the right time and not wasting any time. I mean, teledentistry could revolutionize if we use the right principles. Could revolutionize. You could squeeze out a 1.5 times production just because you're managing and triaging this stuff properly. I can see those light bulbs, by the way. Are they going off?
Well, they certainly are. You know, I think the reality is a little bit of a kick, a catalyst, which I do think that the COVID virus actually has served in this particular case, has certainly given me the kick that I needed to be able to think a little bit differently here. And as we look at this process, if you continue to really put your head in the center of a patient's head, how they want to experience this, it becomes kind of obvious, right? Now, we all need that little bit of a motivation or incentive to make that happen. But when you begin to think that way, you see patients don't want to have to show up in a chair and then say, tell me more about what's going on. How can I help you, right? They don't want to have to, come in on a constant basis. And reality is if you use triage over the phone, the one challenge that I've seen and I've heard from many doctors is, gosh, it'd be great if we had a set of x-rays we can look at too. Well, what if a patient can show up and walk up to any clinic anytime they want without a scheduled appointment, be able to take a set of x-rays, right? On the way home from work, stop by, take a set of x-rays, and then they've got that and they can use that for their teletriage visit whenever they want. It really becomes a different way to serve the patient and meet them where they're at. Now, God knows, I certainly don't have all the right answers in terms of what this is going to look like, right. But the egg has been cracked, right? The egg has been cracked, and now we need to see how to use it moving forward.
And no, I agree with you. I think with every crisis, there seems to be new catalysts that can move the industry forward, and we don't know to what extent it'll do that. But I'm always interested in what Smile Brands does, not in terms of just technology, but in terms of culture and Celebrate Everybody Everyday Smiles has been a big campaign. I use the hashtag too in many of my posts. But you guys launched this Dental Heroes program recently, which I've been following every single day to see and I'm going to let you explain it because it's really inspiring for all of us, not only in dentistry but across our society. So tell us a little bit about what that program is all about.
So if you look at really what's happened here, it's more true than ever that the real heroes of this industry are the people who are on the front lines, who are putting themselves at risk to really serve patients. And now, while we're doing everything we can to make sure those team members are safe, they are exposing themselves, just in the duty in the line of work, even by leaving their house. And so they are heroes in every sense of the word. And you see it in terms of healthcare and certainly specifically with dentistry. And I am deeply proud of those team members who are stepping up and calling for that mission I mentioned before. And so we need to do our part to reward that. And I've asked both of Smile Brands and now of our partners to figure out how we can help recognize those dental heroes. And so we launched what is called the Dental Heroes Pledge. And we've had several partners now and more to come who have pledged to support and recognize those dental heroes. And so as part of our work, we have ourselves an internal health plan that we use, our dental plan that we created many years ago. And as part of that dental plan, we are specifically going to be allocating an increased premium pay for those dental heroes, for those care workers, as part of our insurance program to reward that work that they've done. And we're asking payers across the country, dental payers across the country, just to do the same. Now, as dental payers, it's a pretty interesting scenario for those folks, and they have some decisions that they have to make. Right now, because utilization is down, the premium that traditionally has been paid by employers is less utilized. And so there is some money to work with. Not a lot, recognize that those same employers are struggling to make sure they pay their benefits. And they're going to be asking our payers to figure out how to reduce those premiums or refund those premiums. And that certainly is probably a good answer as well. But there are multiple constituents to serve when it comes to this. And I'd ask my payer partners, as we have, and they are stepping up to now come to the table with not only serving their employer members, but also serving their provider networks. And particularly, I've asked them to see what they can do to be able to, for those folks who have provided care, who specifically have provided for dental emergencies, to be able to provide some type of hazard premium. Now, we've also had other partners join in, by the way, just to add, who have, for example, with our discount programs, we've had other partners who have now extended the membership programs that we've established as part of their way to contribute as well. So we work very closely in extending those memberships for our patients, as well as being able to make sure that our dental heroes themselves, those care providers on the front line, get free.
No, I almost wish the ADA piggybacks on this, the Dental Heroes program, and launches it nationwide, including letting our legislators know that, hey, yes, the nurses and the physicians and hospitals are on the front line, but so are dentists and the team members, and they are doing an equally good job. And I hope that the ADA spends some time kind of convincing the lawmakers that this is essential. This is and then when it comes to a little more guidance in terms of how testing eventually will be performed, I hope that we get recognized as an industry that's an essential industry in helping with this pandemic. So I certainly urge the ADA to look at what you guys have done and maybe do this on a national scale and involve some legislators in place as well.
Well, I think in the end, as you know, governments move at a glacial pace, right? And regulators as well. I think we can do our part as participants in this industry and partners in this industry. Everybody, as I mentioned in the beginning of the call, everybody is impacted in different ways. And it's I think, incumbent upon us to meet that calling and give back in whatever way we can. Not everybody can give back. Not everybody's gonna be in a position where they can make that commitment. But where you are in that position to make that commitment, we would ask for that pledge. And as it relates to testing, I think that's a really important point. We are going to be, we're first in line to be implementing point of care testing just as soon as it's available, to be able to make sure that that's available for our team members and our patients. And when we look at what's happening across the globe, dental practices are getting significantly impacted because of the requirements for PPE, as well as requirements for testing, and just the fact that they've been closed. 25% of practices across the country will not open their doors. And so how do we help those practices too, and be able to support them? And the government's done great things in being able to make funding available. But if you rely on the government purely for your survival, then I think we're going to have a bit of a challenge.
So one of my questions towards the end was that obviously we are all preparing for a comeback, right? We're all preparing for the economy to restart again. And part of, so one of my questions was, what are you guys doing specifically in terms of reopening strategies? Obviously testing is part of that, right? And I'm hoping that we work through some of the healthcare laws in terms of telemedicine, of who can authorize and write a prescription for that test, because there's still some, you need an MD or not. I think there needs to be some guidance allowing dental practices, I hope, to write the script and get that test done and get it paid for by the health insurers. But what are some of the things besides testing, is as you guys are looking at Arizona and Texas and some of the other states that are starting to reopen, anything specifically you guys are doing to get them ready to do that?
Yeah, so as you may know, we are data fiends, and so we collect data on everything and everyone so that we can make sure we're making great informed decisions about when's the right time to make these calls. We are just chopping at the bit to make sure that every one of our practices is open and our team members are back to work. But this goes back to what I mentioned before. The very first thing that we want to make sure is that everything's safe. And as part of that, I'm very, very both proud and believe it's really important for us to know that we've got the safest practices in the country. Every one of our practices has access to the PPE they need, to the training that they need. We actually put videos together about how you specifically need to put on masks, putting on PPE, just so that everybody knows how to do it. Just get that refresher. Office staffs, most folks are not used to wearing PPE. How do we teach them how to be able to do it? Putting guards in place, plastic guards in place. And you'd ask, well, can we get folks in there who can put install those guards from facilities? We've had some of our DMOs, our director of market operations, just step up with a drill and get that taken care of, and hanging that piece of plastic to make sure that that's in place. So really, it's about making sure there's good process in place, there's access to PPE, and it's safe before we open those doors. And the good thing is we've done that. And I'm proud to say that not one of our offices has been a place where either it's been transmitted or exposed and transmitted through this entire crisis.
It's so, as I hear you talk about this, it's interesting to observe that this is all new for us, right? I mean, we've been in this industry. Everybody has been like, my God, and the conversations that we're talking about are so different. And everybody has had to pivot to becoming experts in a completely different skill set than we were. What has been the most surprising aspect of this process for you, as you've been in the industry for a while, and healthcare is obviously, what has surprised you the most?
When you look at your point around expertise, the last time we had experts in a pandemic, those folks are long gone, right? So you could argue today, we don't have any experts in pandemics. We're just trying to figure it out, right? And particularly in dental, we're all working, as fast as we can, as many hours as we can, to try to get up to speed and up that curve.
Sure.
What surprises me, right, is I look at what's happening right now from the decisions that are being made at each state's level, the pace in which they're opening and closing or determining what's essential and what's not essential. It would be helpful to have more consistency there so that we can help. Our decisions can be made using consistent data, right, and consistent facts. But in the absence of that, we're managing at each state level. So what's happening in Florida is different. What's happening in Texas is different. Happening in Utah, different happening in California and Washington. And we've been advocating. The good part about being, larger DSO is that not only do you have access to the resources, et cetera, but being able to really focus on, through relationships with the folks like Steve has and the ADSO and others, to be able to have conversations with those governors of those states, or with the ADA, or the chief dental officer of the United States, to be able to both influence and also hear and understand the questions that they have. So I think that's been important. And in reopening, our strategy really is making sure that we can put our team members in great safe places, but now it's making sure patients know that we're open for business and that they're able to come and stay safe. So that combination of things, well, putting teledentistry in place, putting our PPE in place, communicating that to the world has all been really important.
You know, my last thought on this is I talk to a lot of dental practices all across the country. There are some offices, independent practices today that are in dire straits, right? I mean, they don't have the cash, they don't have the ability to maintain that cash reserve, especially if the openings are not happening for a while. Are you guys, if a dental practice out there was needing to affiliate with you guys today, because you guys could help them with your resources and everything else, are you guys open to those discussions with some of the offices that truly need the guidance and the infrastructure support to survive in the post-COVID world?
Yes, yes, and yes. You know, part of my job, a key part of my job pre-COVID was running all of that work around affiliation and integration to make sure that we've really filtering to find the best partners out there and then developing really great relationships and structures of the relationships so that they can thrive as being part of our family. And that hasn't changed. What has changed, the universe has changed, right? And how you value companies and the multiple at which they would trade, right? Valuing an LTM last 12 months EBITDA right now is extremely challenging, especially considering, you know, this blip that's happened. And so what does the future earnings of an organization look like? So from our perspective, we are committed to every single one of the practices that have already become affiliates and those ones that have signed LOIs with us to become affiliates. We're going to work through each of those one by one. And we're going to find the right structure, the right setup that makes them be successful and goes back to our win-win and our smallest for everyone. For practices that are struggling, and there are a lot, they're reaching out to us already and they're saying, hey, can we work together? Can we find a way to help me through this? And so we are absolutely interested in those conversations. We want to, I've got a set of team members who are chomping at the bit to be able to dive in and figure out what we can do to help those folks. I think in the end, the models that we have, they're not typically just, let's, buy the practice and put them in, right? It could end up being, let's find a way to have you share in the equity model, right? Maybe it's, I'm ready to retire and throw the towel in. I really want to make sure my patients end up in a safe place. We could do something like a chart buyer or a roll-up. Or, folks who want to take advantage of this and really believe that this next now 3 and 5 years are going to be incredible in terms of growth from here. And we can set up a sub-DSO model as well. So there's lots of options on the table. Which one is the right one? We just have to take it on a case-by-case basis.
It really depends on who you want to be as a dentist and what kind of involvement you want within that. But I think this is going to accelerate some strategic partnerships with DSOs. And now the new models are very they're not the traditional models anymore. There's lots of new ways to work with dental support organizations. One of your success has been with Decision One, and it's been a fantastic experience for that group over there in Chicago. I'm gonna leave on the screen some of your contact information for any doctors or anybody else who has questions about anything that Matt has talked about today, including what help they can provide to your practices in this time period. So your email address as well as your LinkedIn contact, we'll leave this on the screen. And bear with him. He gets lots of emails every day, just like I do. But he has promised us that he will get back and arranged at least a conversation with somebody, either him or somebody on his team. So I appreciate.
I certainly will. Yeah, and just Amal, I do want to say thank you again for the work that you're doing to keep the communication open, and just the work that you've done with Patient Prism and the team. You're just driving innovation in the industry and collaboration. And together, the two is where we're going to figure out how to create a better future for dentistry.
And
relationships in dentistry are incredibly important. And you said this earlier on about the type of culture Smile Brands has, but also one that the dental industry has. The healthcare industry has a certain culture. Dental, as I've gotten to know it these past year and a half, 2 years, is really one where really are a lot about helping each other and collaborating. And I see that. And so the relationships we build are based on what our goals are and what we're trying to achieve. And whether it's an affiliation or whether it's using technology or talking about ways to be able to support each other, how do we help each other achieve those wins is really at the heart of what I'd like to do.
I appreciate these ending thoughts. It's always amazing to talk to people who want to make you feel better and who who inspire you to achieve higher. So this has been a wonderful conversation. I appreciate it. We'll continue our talks as this crisis goes along, but we're looking forward to seeing each other at the other end of this crisis sometime sooner than later. So thank you again, and have a safe weekend.
Thank you, Amal. Take care.